Chapter 8 Exam by Madison Younger. Emotional disorder. Emotional disorder is the behavior problems frequently internal exhibited by difficulties in expressing emotions evoked in normal everyday experience. Hardman 178. Children with emotional disorders may exhibit disorderly thinking, excessive anxiety, bizarre motor acts, and abnormal mood swings. Emotional disturbance. This will be helpful to me as a teacher because students that exhibit these problems cannot always help what they are going through. It is important for me as a teacher to be able to identify what a child's needs are. Behavioral disorders. This is a condition in which the emotional or behavioral response of individuals significantly differ from those of their peers and seriously impact their relationships. This can be beneficial to me as an educator because students that exhibit these needs need to be helped early in life, because if you let a behavior problem just keep going, it's going to lead to a very bad future for that student. Definitions and classifications of emotional and behavioral disorders. The definition provides a more precise basis for identifying children and youth with EBD. Its advantages include a consideration of cultural and ethical norm and the inclusion of challenging emotional and behavioral responses of children and youth. These classifications and definitions can be helpful to me as a teacher because I will be better able to know what the restrictions are and how to tell what child is having certain learning problems. Classification system used to describe various groups and kinds of challenging behaviors. According to Hardman on page 178, these systems provide descriptions, uniform terminology, and characteristics for diagnosis. They provide professionals with a shared means for describing certain types of behavioral problems, and they also provide professionals with common terminology when communicating with one another, and they help specialists diagnose and treat individuals. This will be helpful to me as an educator because I want to use the correct terminology when helping diagnose one of my students. I also want to use correct terminology when talking to other professionals. I feel like this is important because if you don't use the correct terminology to diagnose one of your students, then you could completely misdiagnose a student. Externalizing behaviors. On page 180, externalizing behaviors are directed at others, including disruptive, hyperactive, and aggressive behaviors. Hardman. According to Liu, externalizing behaviors can also be classified as antisocial, so that student may exemplify the secluding themselves from their peers. They might not be outgoing and outspoken. And these behaviors are directly affect parents, siblings, classmates, teachers, and neighbors. This will be helpful to me as a teacher because I want to make sure that all of my students are not becoming distracted by this behavior. I want to help students that struggle with this behavior because I feel like it's something that they're dealing with on the inside that they feel like no one else can really understand. Internalizing behaviors. On page 180, it is directed more at themselves rather than others. Liu states that children may develop internalizing behavior problems such as being withdrawn, anxious, inhibited, and depressed behaviors, problems that are more centrally affect the child's internal psychological environment rather than the external world. Liu. And it may be defined as emotionally disturbed. That's Hardman 180. This will be beneficial to me as a teacher because looking for this emotional disturbance in students will help me to be able to help them. Since this is something that they direct more at themselves, it's going to be a little bit harder to see in the classroom, I feel like. Although this child will be anxious and all of that, they feel like they don't have anyone. So it's important as a teacher to know that and realize that. Clinically derived classifications are classifications developed by groups of psychiatric, psychological, and healthcare clinicians. Hardman 180. School personnel and other care providers should be familiar with these classifications as they often work with medical specialists. Hardman 180. The DSM-5 disorder include intellectual disabilities, communication disorder, autism spectrum disorder, ADHD, specific learning disorders, motor disorders, and other neurodevelopment disorders, Hardman 180. This will be helpful to me as a teacher because these classifications come straight from healthcare professionals, which can help me determine what the child is classified as. Attention Deficit and Hyperactive Disorder, ADHD. This disorder is characterized by inattentiveness, hyperactivity, or impulsivity, Hardman 180. Those who are inattentive have difficulty staying focused on learning. These individuals may blurt out in class, interrupt others in conversation, or make decisions or act without proper consideration for consequences. This can be beneficial to me as a teacher because I need to know how to deal with kids who are hyperactive. And teaching younger kids, it's hard to see because younger students are more hyperactive and they are more inattentive. Like it's hard to keep their attention for very long. So that might be harder to see when you teach a younger grade. Oppositional deficient disorder. This disorder is characterized by a pattern of anger, argumentativeness, or defensive of authority. Hardman 180. These students may be irritated easily or lash out at others for no reason. Hardman 181. This is important as a teacher because I need to know how to redirect these students if they are lashing out. This type of behavior can make for a very tense environment in the classroom, and I don't want any of my other students feeling on edge because of how this student is acting out. Intermittent explosive disorder. This disorder is characterized by volitive verbal or physical aggression at least twice per week. Hardman 181. Outbursts come on suddenly and often with little provocation, and usually end in less than half an hour. This is useful as a teacher because sometimes students need a breakaway moment from the classroom. Tenseness can build up and cause the student to become outraged. It is important to notice this and learn how to handle it in the classroom. Conduct disorder. A disorder in which an individual regularly violates the rights of others and may lack remorse about or concern for their behavior. Hardman 181. On page 181, it states that this could be threatening, bullying, fighting, destroying property, or even stealing. This can be helpful as a teacher because if a student displays these actions, then the student needs to know that there will be consequences, even though they may still disobey because they don't care what the consequences are. Pica is a disorder characterized by consumption of non-nutritive materials, for example, cloth, hair, plasters, or even paint. This is important as a teacher, especially in grade school, because younger kids do have the tendency to eat crayons and glue. But if the student does this more frequently, then I might have reason to believe that the student has an underlying nutrition problem and may need to seek medical attention. Anorexia nervosa is a disorder caused by fear of gaining weight or disoriented body perception and body weight loss than minimally normal. This is important as a teacher because students who have a negative perception of themselves often want to be an ideal image. I think it is important as an educator to encourage students and uplift their spirits. Bulimia, a disorder characterized by episodes of binging followed by self-induced vomiting or other measures. Hardman 181. This may result in depressed mood, social withdrawal, irritability, and other serious medical conditions. Hardman 181. This is important as a teacher because I need to be aware of these signs. These students need to help and need to know that they are not alone. Rumination disorder. This is a disorder characterized by repeated regurgitation and rechewing of food. Hardman 181. This is important information to know because if the student continues to do this, medical attention may need to be brought up to the parents. This child might also be self-conscious of this disorder, which may lead to isolation. Tic disorders. A disorder characterized by involuntary, rapid, or current movements or vocalization. Hardman 181. This includes Tourette syndrome, persistent motor vocal tic disorder, and provisional tic disorder. These students may have excessive eye blinking, facial gestures, sniffing, snorting, repeating certain words or phrases, or grunting. This is important as a teacher because students who have this disorder may be conscious of themselves. People often repeat words or phrases because they mess up and they feel like, oh no, they're listening to me, or oh, I said that wrong, so I better say it right the next time. And so they become nervous. And students may need help and reassurance. Elimination disorder. This is a disorder characterized by swelling and wetting in older children, Hardman 182. These children often have bowel or bladder problems past their fourth or fifth birthday. And this can be important as an early educator because if they continue to wet their pants, they may have this certain disorder. It can be important to let other educators know the problem as well as the parents. Anxiety disorder. This is a disorder characterized by difficulty in dealing with fear-provoking situations and with separation from attachment figures, Hardman 182. These students are persistent about not coming to school, reluctant to go to sleep, and repeating complaints about headaches and stomach aches. This is important as a teacher because these students are just afraid. It's not that they don't like school, but it's because they make up these scenarios in their heads that make them afraid and that make them sick and make them not want to come to school. So it's important to make sure that you make your students feel comfortable and safe in the environment. Selective mutism, a disorder characterized by refusal to speak in specific social situations, Hardman 182. This disorder appears in the first days or weeks of attending school or participating in a new social environment. This is useful as a teacher because you don't want to make students uncomfortable, but you also want to push them to new boundaries. So you don't want that student to be completely unsocial for the whole year. Reactive attachment disorder. This is a disorder characterized by noticeably abnormal or developmental incept of social relatedness, Hardman 182. This can occur because of physical or emotional neglect, frequent changes in caregivers, or other abuse. This can be an important thing to know as a teacher because some students act in this way because of their home situation. The fact that these children don't know if they will have a place to stay or are constantly being removed from homes can make their situations hard. Childhood schizophrenia. This is a disorder characterized by severe behaviors such as hallucinations, delusions, irrational behavior, and strange thinking, Hardman 182. This is important as a teacher because these students need to be isolated as they can do harm to themselves or to others. But at the same time, these students don't know what's wrong with them. Like they don't understand what these things that they're seeing or these delusions are. Intelligence. The IQs of students with EBD are the best predictors of future academic and social achievement. Hardman 182. Below average IQs of many of these children contribute to the challenges they experience in mastering academic content and developing other important school-related social and adaptive skills. This is important as a teacher because most of these students who have EBD are not socially adaptive. They usually have average to below average IQs. Social adaptive behavior. Children and youth with EBD tend to have a hard time adapting to their home, school, and community environments. Hardman 183. Socially, children with EBD have difficulty sharing, playing typical age-appropriate games, and apologizing for actions that hurt others. Children who are anxious and withdrawn frequently exhibit behaviors such as selectiveness, seclusiveness, and shyness. This is important as a teacher because students with EBD tend to express themselves differently. They can go from being shy or not being able to get along with classmates at all. So it's very different extremities. Bipolar disorder. This is a disorder characterized by episodes of manic and depressive behaviors, Hardman 184. Manic behavior includes authority, aggression, agitation, sleeping very little, inappropriate sexual behavior, and racing thoughts, Hardman 184. Depressive behavior includes crying spells, extreme sadness, lack of interest, or inability to concentrate, Hardman 184. This is important as a teacher because this type of disorder can be expressed at a young age. It is important to realize these symptoms so that the child can be helped early in life. Bullying and cyberbullying. Bullying is the behavior that uses physical, emotional, verbal, or sexual aggression to gain strength or authority over others. Hardman 184. Cyberbullying is the use of social media for bullying, Hardman 184. This is important as a teacher because bullying should not be tolerated. When you see that another child is trying to be authoritative to one of their peers, intervention should take place immediately. Academic achievement. Students with EBD experience significant difficulties and deflects in academic subject areas and are rarely able to catch up academically. Hardman 186. Some attribute these poor outcomes to the preparation of teachers who work with these students. This is important as a teacher because you want your students to succeed in academic achievement. I don't want to be known as a teacher that did not try to help my students or that just let my students fail because they were having a hard time. Screening for assessment. This is designed to identify children and youth who may or may not present EBD, Hardman 188. Once the child is identified, then the teacher can start interventions. Screening is based on the idea that early identification leads to early treatment. This can be beneficial as a teacher because if a student displays signs of EBD, then it won't hurt for early interventions to start. Pre-referral interventions for assessments. Pre-referral interventions are designed to address student-identified behavioral and academic problems and to reduce the likelihood of further problems, Hardman 189. These are usually implemented through a multidisciplinary collaborative team. This is helpful as a teacher because it is nice to know that you're not the only one who is trying to help a student. There are other people that will be helping and guide you. Referral for assessment. The actual submission of a referral for a student is generally preceded by several parent-teacher conferences, Hardman 189. Referrals are generally processed by school principals who review them. After the referral is complete and parents approve them, the team can start the process. This is helpful as a teacher because the team really helps a lot by making new ideas and evaluations of the students. Because you might see the student as one thing, but once you start looking at it from a different perspective, you might see the student as something else. Collaborative teams. Collaborative teams help to create and generate ideas for students. They help teachers to implement their ideas and to use them in the classroom. This can be helpful as a teacher because it is nice to know that there are people there to help you with this process and that these teams deal with these students and the parents. Assessment factors. IDEA requires assessment team members to conduct functional behavioral assessments and to document the impact of the EBD of the children. Hardman 190. Fictional behavior assessments are assessments used to gather information about a child's behavior, identify potential reasons, and use this data to develop, support, and improve strategies. This is helpful as a teacher because these assessments can be very beneficial when it comes down to the students and his or her needs. Assessment approaches and procedures. Parents and teachers are asked to respond to a variety of rating scales and items that describe behavioral relatedness to that child. Strength-based testing is a positive form of assessment, Hardman 191. The group of assessors will assess the child on the playground and even in the classroom to gain a better understanding of how that child will react to certain things. Hardman 189. This can be very beneficial as a teacher because you can use these assessments to be better able to help the student. Multidisciplinary collaborations and systems of care. One very promising practice is a wraparound approach. This is a very intensive, complete team community approach of involving children and youth and their families so that they can thrive in their homes, local schools, and communities, and develop the skills and behavior needed for successfully living and learning. Hardman 193. This can be helpful as a teacher because it is important that students not only do well in school but also in life. So the fact that this team is trying to help push the community, family, and children to thrive is amazing. SEC standards. Standard 1 is the foundation. Standard 2 is the development and characteristics of learners. Standard 3 is the individual learning differences. Standard 4 is the instructional strategies. Standard 5 is the learning environments and social interactions. Standard 6 is the language. Standard 7 is the instructional planning. Standard 8 is the assessment. Standard 9 is the professional and ethical practice. And Standard 10 is the collaboration. And this is from the Council for Exceptional Students Professional Standards of Common Core. These standards help set guidelines for educators and can help teachers when trying to help students. This is important as an educator because these standards help you when you're working with that student, so you know the language, you know the foundations, you know how to develop and characterize the learners. Phases of the wraparound process and point card for IEP goals. The phase 1 is the engagement and team preparation. Phase 2 is the initial plan development of the team. Phase 3 is the plan implementation and refinement team, and phase 4 is the transition team. The point card is basically how the student performed that day. You also put an IEP at the top and tell whether they performed well that day. This is very helpful as a teacher because this can help you see where the student stands and what needs to be improved for that student. For example, if the student's IEP goal of the day was to raise their hand to get the teacher's help, and they just were not doing very good at that, you could see that in their point card. So you could use that to reflect on. And this is the works cited.